Hello friends, today let's talk about the topic organization of a corrective gymnastic class, that is group therapy, and its advantage. So let's start with the introduction. There is a wide range of possibilities of corrective gymnastic in the prevention of poor body posture and deformities. The main objective of the corrective gymnastic is to monitor and improve the postural status of children and youth. There are many faulty postures adopted unknowingly, such as hypokinesia, improper sitting, standing, and long working hours, and they contribute to a disruption of postural status and the decline of the level of physical abilities of children, youth, and adults. The corrective gymnastic exercise is an exercise technique which is very different from other regular exercise program. It starts with a detailed analysis of the physical arrangement of the body. This analysis helps in determining any imbalance or deficit that could be affecting an individual performance and their daily activities. After this analysis, a very specific corrective exercise and flexibility program is developed to help to correct the body structure and bring it back to its normal state. The corrective gymnastic exercises are designed to make positive changes in the way an individual moves, and they concentrate on the underlying causes of the pain, as the best way to eliminate pain is by eliminating the causes. The definition of corrective gymnastic. The scientific use of bodily movement to restore normal function in disease or injured tissue or to maintain a state of well-being is called the corrective exercise. As with any type of therapy, a therapeutic exercise program is designed to correct specific disabilities of the individual patient. The program is evaluated periodically and modified as indicated by the patient progress and response to the prescribed regime. Exercises affect the body locally and systematically and bring about changes in the nervous, circulatory, and endocrine system as well as the musculoskeletal system. So next comes the meaning of corrective gymnastic class. The program of corrective gymnastic includes low-intensity exercises for who want to stretch out and build muscle in a slower rhythm. It is important to note that maintaining upright body position requires constant adjustment of muscles of the trunk and limbs, which are under the automatic and conscious control of the central nervous system with the aim of confronting the force of gravity. The principles of corrective gymnastics are directed to the solution of each specific deformities in order to establish normal relation between structure of the musculoskeletal system. It includes exercises that are correcting deformities and poor posture as well as the prevention of spinal curvature and the weakening of muscles. The corrective gymnastic classes includes increase or maintain mobility of the joint and surrounding soft tissue, develop coordination through control of individual muscles, increase muscular strength and endurance, promote relaxation and relief of tension. The next one is joint mobility. In the absence of a disability that prohibits mobility, the regular day-to-day activities maintain the normal movement of the joints. If, however, motion is restricted for any reason, the soft tissue becomes dense and hard, and adaptive shortening of the connective tissue takes place. These changes begins to develop within 4 hours after a joint has been immobilized and are evident even in a normal joint that has been rendered immobilized. It is for this reason that therapeutic exercise to prevent loss of joint motion are so important and should begin as soon as possible after an injury has occurred or a disease process has begun. The prevention of the loss of joint motion is much less costly and time-consuming than the correction of tissue changes that seriously impair joint mobility. It is recommended that each joint should be put through its full range of motion 3 times at least twice daily. If the patient is not able to carry out these exercises, he is assisted by a therapist or member of the family who has been instructed in the exercises. The inflammation of the joint, as in arthritis, may cause some pain on motion, and so passive exercises are done slowly and gently with the joint as relaxed as possible. The procedures that stretch tight muscles to increase joint motions should be done only by a skilled therapist who understands the hazards of fracture and bleeding within the joint, which can occur if the exercises are done improper or too strenuously. Next is the muscle training. The exercises of this type are taught to the patient who has lost some control over a major skeletal muscles. By learning precise and conscious control over a specific muscle, the patient is able to strengthen and coordinate its movement with normal motor pattern and thus enhance mobility. Muscle training or neuromuscular reeducation demands full cooperation of the patient, who must be capable of understanding the purpose of exercises, following direction, and giving full attention to the muscle isolated or for retraining. The sessions are held in a quite comfortable atmosphere to facilitate concentration by the patient. The development of conscious control over individual muscle is useful in the rehabilitation of patients with a variety of disorders, including physical trauma, diseases such as poliomyelitis that affects the motor neurons, and congenital disorders such as cerebral palsy. It involves a systematic program of sequential activities around the direction of a therapist knowledgeable in the technique. Although it requires much effort on the part of the patient and the therapist, the attainment of the muscle control and coordination is a satisfying reward. Next is muscle strength and endurance. The improvement of muscle strength and endurance is particularly important in the rehabilitation of a patient whose goal is to return to an active and productive life after a debilitating illness or disabling injuries. The exercises are prescribed according to the individual needs of the patient and usually involve more than one group of muscles. The next one is the strengthening with force increasing exercises. The strengthening exercises are prescribed after an examination has shown weakness in individual muscles or muscle groups. These exercises are usually administered with relatively high resistance and few, that is 3 to 10 repetitions. A group of exercises called a set is followed by a few minutes of rest. 3 to 5 sets for a muscles or group constitute one bout of exercise. The strengthening exercises are often performed daily in early stage of rehabilitation, but less often later in treatment. Next is the endurance exercises. The endurance exercises stimulate changes in the involved muscles or muscles, resulting in improved capacity for repeated contraction, for example, increased ability to use metabolites. When conducted over a sufficient length of time and with several muscle groups, they may also produce central effect of the cardiovascular system. The endurance exercises employed relatively low resistance and numerous, that is 15 or more repetitions. The endurance exercises are generally administered daily. Next one is the relief of tension. These exercises that promote relaxation of the muscles and provide relief from the effect of tensions are useful in a wide varieties of disorders ranging from mild tension headache to insomnia. Patients who are especially tense may require several sessions of instruction in relaxation before they can learn the technique. The next one is the purpose of corrective gymnastic classes. The corrective gymnastic exercise is a type of exercise that helps in bringing the body back into its normal postural position. The body is designed such that it performs at its maximum level when it assumes as proper posture. However, many individuals tend to pick up bad posture habits such as slouching, leaning, sitting at desks in awkward position at work. Gradually, this wrong position is assumed in daily activities, causing tightening or stiffness in certain regions and loosening in other areas. Muscles become weak and may not also work. For example, a person's left hip may not be working properly. This may result in a rotator cuff problem or tight calf muscles. If the movements are compromised in one region of the body, it will cause symptoms in another part of the body. The corrective gymnastic exercise helps in reversing this compensation and imbalances and directs the body to work in coordination and without pain. The corrective gymnastic exercises helps in loosening the tense and stiff muscles and activates the lazy muscles. Basically, it helps in retraining the body to move as it was designed to move in order to function at its maximum level. The corrective gymnastic exercises enhances the body biomechanics and eliminates the negative stress from the body, as this negative stress built up in the body resulting in pain and affecting the body's normal range of movement. Through the corrective gymnastic exercises, the correct structure of the body is restored and the body stops compensating for imbalances and the person is able to move freely without pain. Next comes the advantage of corrective gymnastic classes. First, flexibility. Flexibility is a primary factor in gymnastics. Increasing flexibility can also be an effective aid to the reduction of injury, preventing people from forcing a limb to an injurious range of motion. By learning movements and combining them in a routine, the gymnast can attain greater flexibility and greater control of the body. The disease prevention. Participation in gymnastics can help maintain a healthy body, which is a key to preventing numerous health conditions such as asthma, cancer, obesity, heart disease, and diabetes. Being involved in gymnastics helps encourage a healthy lifestyle, including regular physical activities and eating a well-balanced diet. Strong and healthy bones. Participation in weight-bearing activities, including gymnastics, can develop strong, healthy bones, which is important to develop at a young age. As we age, we inevitably experience decrease in bone mass every year. Building strong, healthy bones at a young age can help reduce the risk of developing osteoporosis later on in life. Fourth, increase self-esteem. A study conducted by researchers at the Robert Wood Johnson Medical School have indicated that children who participate in the physical activity like gymnastics are likely to have better self-esteem and self-efficacy. Daily exercise needs. The American Heart Association recommends children participate in 60 minutes of physical activity per day. Adults aged 18 and over should participate in 30 minutes of exercise at least 5 days per week. The participation in gymnastics helps meet the exercise recommendation set forth by the American Heart Association. Increase cognitive functioning. The participation in gymnastics does not only offer physical gains, it is beneficial for improving concentration and mental focus. An important aspect of anyone's life. Gymnastics allows children the chance to think for themselves, to stimulate their imaginations and to solve problems safely. Increase coordination. The gymnasts do not react with as large as startled response to sudden imbalances as non-gymnasts. By applying this condition outside the sport, people become better equipped to avoid hazardous situations by quickly identifying them and naturally correcting body alignment when walking, standing or jumping, etc. The strength development. The gymnasts produce pound for pound the best athletes in the world. The gymnastics use almost exclusively body weight exercise to build upper body, lower body and core strength. Discipline. Gymnastics install a sense of discipline. Each student must have the self-control to make correction when a coach asks them to, and they must also have the self-discipline to stay on task when a coach is working with another gymnast. And last one is social skills. At all ages, gymnastics provides an opportunity to develop social skills. The younger children learn how to stand in line, look, listen, be quiet when others are talking, work and think independently, and how to be respectful of others. The older kids learn how to set a good example for the people who look up to them and become role model at a young age. So here comes the conclusion of today's topic. The basis of corrective gymnastic exercises is that each muscle is connected to another muscles and the nervous system that communicates with all the joints and muscles. The corrective gymnastic exercises helps in reintroducing appropriate structure in the body, thus enabling a person to move freely with less pain. The corrective gymnastic exercises benefits people of all abilities and ages. For an athlete or a sport person, the corrective gymnastic exercise helps in enhancing efficiency and performance level, reduce the risk of injury and allows the body to rehabilitate in the best way from injury. The corrective gymnastic exercise focus on resolving the causes of pain instead of addressing the symptoms only. It is a simple and effective method for pain relief, thus allowing us to live a full and active life.